recording after as well. Okay. Thank you for joining us today for this important conversation about suicide prevention, gun violence prevention, and the implementation of our state's new Extreme Risk Protection Order, or ERPO law, also known as a red flag law. I'm Kate Raditz with McClung PR. I will be the moderator of this discussion today. Gun violence is an urgent public health and public safety issue. Here in our state, gun deaths have risen sharply over the past decade, with impacts spanning suicides, community violence, and mass shooting threats. Today, we'll be making references to a new report that was released by the Center for Gun Violence Solutions at Johns Hopkins Bloomberg School of Public Health this month. We will also reference research done by Dr. Tracie Rutherford Self at Minnesota State University, Mankato, along with the Center for Rural Policy and Development on suicide prevention. And today we have some incredible experts with us with unique perspectives on these issues. I'm going to let each of them say a little bit more about themselves before we get started with questions. First, we have Maggiy Emery.
Hi, good afternoon. I'm really excited to be here in Rochester, where I lived for a couple of years, so excited to be back. My name is Maggiy Emery. I'm the Executive Director of Protect Minnesota, which is the only state-based, statewide gun violence prevention organization here in our state, trying to tackle gun violence in all of its forms, including firearm suicide, interpersonal violence, homicide, domestic violence, and accidental shootings. And before we get started, I did just want to say a word about Melissa Hartman. I know that we're here today mostly to talk about firearm suicide, but gun violence is, as we all know, a broader issue. And we lose almost 600 Minnesotans a year to gun violence. So this isn't something that's unique in this situation at all, but we know that Speaker Hartman was a true champion on this issue, and she helped us in 2023 and 2024 pass a number of the life-saving measures that we're going to talk about today. Without her leadership on this issue, we wouldn't be here. We wouldn't be able to talk about the lives that we have been able to save in Minnesota. So I just want to acknowledge that she's not here because of an act of gun violence, and that we have work to do today and beyond to make sure that those 600 deaths and particularly those political assassinations never happen again in our state. And with that, I'll hand it back to Kate.
Thanks, Maggiy. Next, we have Lisa Geller.
Hi, everyone. My name is Lisa Geller. I'm the Senior Advisor for Implementation at the Johns Hopkins Center for Gun Violence Solutions. I lead our team's implementation work, which means once Kelly's worked with all our partners to pass laws at the state level, I work with state actors, law enforcement, judges to help make sure those laws are implemented and actually working, because if you pass a law and you don't work to implement it, it doesn't do much good. I also co-lead the National ERPO Resource Center, which is funded by the Department of Justice. We are a national training and technical assistance provider to all of the jurisdictions with extreme risk protection order laws. So thanks for having me.
Thanks, Lisa. We have Kelly Roskam.
Hi, thank you for having me today. My name is Kelly Roskam. I'm the Director of Law and Policy at the Johns Hopkins Center for Gun Violence Solutions. As Lisa mentioned, we're colleagues and work together. My role in this is to help states develop policies. So I've been deeply involved in the development of extreme risk protection orders, starting with California's gun violence restraining order and many of the extreme risk protection orders that have passed in the 21 states, DC and the Virgin Islands since that time. I'm also involved in policy development of other gun violence prevention policies like safe storage, domestic violence, firearm relinquishment, firearm purchase or licensing laws, and many others, and work very closely with state groups like Protect Minnesota to advocate for those policies.
Thank you. Thanks for being here. And Dr. Tracie Rutherford Self.
Hello all, and good afternoon. So I am Dr. Tracie Rutherford Self, and I am an associate professor in the Counseling and Student Personnel Department, as well as an associate director at the Center for Rural Behavioral Health. That's at Minnesota State in Mankato. I'm also one of 3 agricultural mental health specialists currently in the state of Minnesota. I work a lot on suicide prevention, both from a research as well as active standpoint, and my primary populations I work with are in the rural areas. So I work a lot with agriculture and farming, as well as rural first responders. So we spend a great deal of time talking about suicide prevention in each of those communities.
Thank you so much. And I'm just going to dive right into questions here, and I will try to leave a little bit of time at the end as well if anyone has any questions, if you can hold them until the end. So first question is, why is it so important to center suicide prevention when you have the gun violence conversation, Maggiy?
Yeah, so The main reason is because firearm suicide represents the vast majority of gun deaths in Minnesota. Year over year, it's more than 70%. That is unique to Minnesota. Firearm suicides do make up the majority of gun deaths around the country, but our rate here in Minnesota is especially high. So we truly cannot have a conversation about gun violence in Minnesota that doesn't include firearm suicide and the huge scope of people who are dying by this, dying in this way across our state and particularly in greater Minnesota.
Does anyone else want to weigh in on that as well?
Yeah, I mean, I think Maggie really hit it on the head. I think one of the things that's often missing from the conversation about gun violence is how much of a focus there should be on firearm suicide. I think the vast majority of coverage is about things like mass shootings in schools and in nightclubs, but you're much more likely to be touched by firearm suicide than you are by any of those things. And it's strange that we don't seem to count it as gun violence in the same way.
You know, what makes gun violence prevention not just a criminal justice issue, but also a public health and community safety issue? Lisa, maybe we can start with you there.
Sure. So I'm a public health researcher at Johns Hopkins. So I care especially about public health and viewing gun violence as a public health crisis, meaning that it affects everyone and it's something we can address at the population level. I think about the public health versus the medical model. In public health, we're talking a lot about prevention. We're talking a lot about reaching people at the population level. And with the medical model, we're really talking about the individual level and addressing, it's usually more reactive than preventive. And so in public health, when we're talking about all the policies that we advocate for, that Protect Minnesota advocates for, it's all about how can we intervene and prevent something before it happens. That's how ERPOs were designed. And when we talk about ERPOs in the suicide context, every 17 to 23 ERPOs issued prevents one suicide. So we have the best available data from a number of states now for the impact that ERPOs can play in suicide. And when we're looking at the data from Minnesota, we're seeing, in my opinion, potentially underutilizing ERPO in a suicide prevention context when 72% of the gun deaths here are suicides.
And sorry, could you just maybe lay out what an ERPO is for folks in the room who don't know?
Sure. So extremist protection orders are civil protection orders modeled off of domestic violence protection orders. And the goal is to intervene before a tragedy happens, before someone has committed an act of violence, either suicide or interpersonal violence, and a court will grant an order. If the court grants an order, then an individual's firearms are removed if they have firearms, but also they will be prohibited from purchasing firearms and possessing them for the duration of the order. So they will be entered as a prohibited person on a background check as well. So if there's one thing you take away about ERPOs, you don't have to have firearms for them to be used. They can also prevent purchase of future firearms.
This question, I think any of you could answer, but are there any misconceptions or is there a biggest misconception about firearm suicide that you encounter in your work?
I think the biggest thing is for people to understand the degree to which the vast majority of suicides that occur where there's a firearm involved are going to happen within a matter of moments to hours. So because we're having this happen so quickly, being able to have either safe storage or removal of a firearm through ERPO is really going to be key in saving lives because we have that impulsivity component that tends to come into play when we're looking at suicidal deliberation. And so for that reason, I think it's really important to talk about firearm safety in relationship to suicide.
And Tracie, I do have a few questions specifically for you because I know you've done a lot of research on suicide in Minnesota. What do we know about the connection between firearm access and suicide risk in rural Minnesota?
So rural Minnesota obviously has a higher population of individuals who have gun ownership. So we're looking at almost 50% of all adults in rural Minnesota have a firearm that they actually have either in their home or in their possession. So when we have that high of a number, we have to look at a couple of different factors here. And so one of those things is, again, when we have access to means and we have particularly issues with impulsivity or something that happens quickly, a lot of the times when we have a suicide, it's because there's been a fight with a partner. And so it's something that's going to happen, again, within a matter of moments or hours. This isn't necessarily individuals who are chronically suicidal. But I think the other thing that we have to kind of approach this from, as someone who's provided services in rural communities for a very long time, is the myth of what an ERPO actually does. So a lot of times there is this belief that if you come to see me as a mental health clinician and I give you a diagnosis, which is something I have to do if we are billing your insurance, that you're going to have a diagnosis and that automatically means you're going to have removal of firearms. And unfortunately, what that's meant for some people in rural communities is they don't come to see me because they're afraid that I'm going to somehow pathologize any thoughts of suicide, which is actually a really common factor for anyone who comes into the counseling world. To think that, all right, if I've had a thought of suicide, it must mean I'm immediately going to be hospitalized. These are the steps that are going to happen. And so I think a big part of working with rural populations who do have greater access to means is to explain the idea that this is about being protected. It's in the same way that if we look at someone who has had, they've had a great 4th of July weekend and they had a case of beer while they were there, we would take their keys, right? We would be able to go in and say, hey, today, right now, you're not safe to drive. And I think we look at ERPOs in the same kind of context. We're looking at this as a temporary removal. And as a temporary removal, we're looking at it from a safety perspective. And so I think when we start approaching it that way from a rural perspective, understanding the culture around gun ownership there, and then saying we're trying to be honoring of the culture, but also making sure people stay alive.
Are there unique challenges or opportunities that you see when it comes to implementing ERPOs in rural communities?
Or both, obviously. So, I mean, the biggest thing is, again, the education piece, understanding what this means. It's so easy for someone to hear about an ERPO and, again, assume what it means, or assume if I go see a counselor that it's going to automatically mean that we're going to be taking these steps. But what we're looking at is for really severe and persistent mental health issues, if it's a mental health concern, before we get to that step. So I think some education around what this actually means and what we're trying to accomplish is really probably the biggest piece in having rural citizens really accept, hey, this isn't about people not understanding me from a cultural context, which already kind of happens from a mental health perspective. But I also think the real opportunities here is as that message starts to pervade rural communities and people understand what the goal is, I don't think there's anyone who is opposed to the idea that we want to keep people safe. It's just making sure that the message is sent out in such a way that, again, feels both honest and honoring to members of rural communities.
Thank you. Kelly, how does Minnesota's new ERPO law compare to similar laws in other states?
So Minnesota's ERPO law is really similar to what I think we conceptualize as the modern extreme risk protection order. So the first state to pass a law of this kind was Connecticut in 1999. They called it at that time a risk warrant, and it was available only to law enforcement and state's attorneys there. It was in the form of a warrant where law enforcement would go to and search for and seize firearms from the home. The modern extreme risk protection order comes from California, which, as Lisa mentioned, is modeled much more closely after domestic violence protection orders. And like many other states in Minnesota, it's available not only to law enforcement, but also to family and household members who may petition because they're concerned about a family or household member, not only for, and not even primarily for mental health, but for any reason that they would be concerned about an individual harming themselves or somebody else. So it could be a financial crisis, it could be alcohol misuse, it could be substance misuse. You go before a judicial officer, you need to meet a finding, and the judge needs to make that finding that that person is in fact a threat to themselves or others by having access to a firearm, either one they already possess or one they may buy in the future. So this is what most extreme risk protection orders in the 21 states, the District of Columbia, and the Virgin Islands look like now. In terms of time, also very similar across states. The temporary order lasts up to 14 days. The final order lasts between 6 months and 1 year. Some states have varied in some of these respects. Other states authorize licensed healthcare providers to be petitioners, employers, school administrators. Sometimes orders can last longer. In California, they can issue one of these orders for up to 5 years, which reduces some of the administrative burden on petitioners having to come back year after year to renew an order for somebody for who a crisis persists.
And what does the research tell us about how ERPOs save lives, especially around suicide prevention?
There is a lot of research about the effectiveness of extreme risk protection orders. Some studies conducted by our research colleagues at the Johns Hopkins Center for Gun Violence Solutions, others by others at research universities. As Lisa mentioned, one study shows that for every 17 to 23 ERPOs issued, one life is saved by suicide. And I know for some people that can sound like not very much. But I myself have been touched by firearm suicide, and I can say from personal experience that one life for every 17 to 23, I mean, that can be somebody's entire world. I mean, think about the person that you love most. Would you think that that's worth it? And I do, and I think most others would agree.
So sorry to hear that, and thank you for sharing that. That's very powerful. For Lisa, what are the most notable data points for Minnesota's first year of ERPO implementation?
Sure. So Minnesota's had the law in place now for a year and a half. So luckily, thanks to the way your law was written, there is really good access to data almost in real time in Minnesota. And there are researchers in the state that's been studying how the law is working and how it worked in the first year. The first year that it was implemented, so last year, 2024, there were 135 ERPOs in the state, which we like to say that there's no right number of ERPOs. I'm not going to say that's too many. I'm not going to say that's enough, because I think it's more about the circumstances in which they're being used. And our primary concern as a ERPO training and technical assistance center is that ERPO is used in the situations where it's appropriate to do so. And so in Minnesota, 71% of those orders were petitioned by law enforcement. I think that's interesting because that's actually lower than a lot of states, even states that have expanded petitioning power to healthcare providers, as Kelly said, family, household members, law enforcement. There are usually, most of them are being done by law enforcement around the country. State like California, where they have a whole host of other people who can petition, over 95% of those orders are petitioned by law enforcement. So here we are actually seeing there's probably been some education done that family members know about this law. I think there can always be more done. But the fact that not 100% of them were petitioned by law enforcement is interesting. I will also say that in talking to law enforcement, I do that every day around the country, those 71% in Minnesota, I'm guessing a lot of those were initiated by a family or household member at first. So going to law enforcement saying, I'm worried about my loved one. I'm worried about, they're threatening a mass shooting, they're threatening suicide, there's domestic violence. There's a whole host of ways that an ERPO can be used. And I think that's another beauty of the law, is that it's not necessarily designed for one purpose, though we do see really good evidence in preventing suicides, and we see a lot of them being used for domestic violence and mass shootings prevention. There's a lot of situations, including political violence, which I think is really relevant as we're sitting here in Rochester, in a state that was, deeply affected by lawmakers being shot and killed in the last month. So I would say that's one interesting finding. And then I would just say that there needs to be continued education and awareness about how this law is intended to be used and how it's not going to be appropriate to be used, because when we're talking about suicide, there's a spectrum of care and interventions. I think ERPOs might be one of the most extreme, where you're removing a firearm. I think mental health codes and involuntary commitments, when you're removing a person, are even more extremes. But there might be other interventions. Dr. Self said that you can, removing someone's keys is, a pretty simple intervention if they're drinking and threatening to get behind the wheel of a car. I think there's other ways you can do a temporary transfer of firearms. You can counsel them about, not having firearms while they're in crisis.
Thank you. Maggie, can you talk a little bit about what the advocacy journey was like to get this law passed?
Yeah, absolutely. So extreme risk protection orders were first proposed in Minnesota almost a decade ago. So it was quite a long journey to get them actually passed into the point of implementation. And what it really comes down to is education, right? When these were first introduced, they were a fairly new tool, and folks didn't know A, what they were, and B, we didn't yet have the research to be able to say, we know that they're always effective. So it really came down to being able to tell folks that this is the effectiveness of an ERPO in a state where we consistently see hundreds of firearm suicides every year. This tool has been shown in other states with similar demographic makeups to actually be impactful in preventing this kind of firearm violence, right? And, especially for those folks who do represent rural areas where firearm ownership is a concern, it really came down to having conversations about how this is not a punishment. And that's something that I really want to drill in. This is not to punish anyone for being a firearm owner. This is not to take a right away. This tool exists to help prevent tragedies, and everybody from all over the state has been touched by a firearm tragedy in one form or another. So what it really came down to was talking to legislators who were going to vote on this. Yes, about the numbers. Yes, about how effective this is, but the same way that we change hearts and minds about anything else is helping people to understand the emotional toll of this crisis and helping legislators to understand, what does this crisis look like in your district? Here are your constituents who have felt the impact of firearm suicide and who are scared that their relatives are going to get hurt. And legislators really listened to that. And, it took a really long time, but we did get folks to the point where they understood what this tool is, why it's effective, and why we do need it here in Minnesota.
Thank you. Tracie, ERPOs are designed to temporarily separate individuals in crisis from firearms. From your perspective as a suicide prevention researcher, how critical is that kind of intervention when someone is at risk?
I think it's absolutely imperative. Because what we want to do is remove the access to means. And I know, and the report does a really nice job as you guys look through that about discussing the fact that, okay, what happens if we remove access to firearms? Aren't there other ways people will die by suicide? And while that is a potential, it's actually very rare. So when we start looking at what the data says, firearm death is the vast majority of deaths that are going to occur when a suicide attempt happens. So if we can remove that access, then we typically remove the ability for someone to actually die by suicide. So when we look at it from a saving lives perspective, it's absolutely critical that we remove the access to firearms in at least those instances and in those moments. And we look at rural populations who, again, are the highest population of gun owners in the state of Minnesota. We also know they're almost twice as likely to die by suicide. So it's really important that we start to have those conversations about, this is a way of being protective. I really appreciated what Maggiy said about, this isn't a punishment. This isn't about trying to take away rights. This is about saving one life at a time, right? And I think for anyone, if we look at this about, we want to save lives, and that's the goal of an ERPO, then I think people get behind it in such a more positive way. And then we also look at what leads up to that. I mean, an ERPO, as you said, was a more extreme route. Like, what we want to do is find ways to make sure that guns that are in the home are safely locked, or that if there's a point at which we think there could be a risk, that we're finding ways to start to mitigate that risk. And this is only one of the tools that we would utilize for that.
I'll get back to ERPOs too in just a minute, but I do want to touch on, talk about safe storage. For Kelly, how important is safe storage when it comes to suicide prevention efforts and gun violence prevention? And what do we know from the data?
So safe storage laws are really critical, both for suicide prevention, but also for gun violence prevention more broadly. And I think particularly for youth. There are a lot of youth living in homes where there are firearms, and more than 50% of gun owners do not securely store their firearms. And despite what parents think, children do often know where guns are stored in their home. The last year of complete data from CDC, it's the highest ever recorded number of suicide deaths in the nation. And we're seeing a sharp rise, particularly of suicide among Black youth, firearm suicide among Black youth. So secure storage is critical. 26 states and DC have some kind of secure storage law. Many of those are child access prevention, so imposing liability on individuals who allow children or prohibited persons to access firearms in their home. But really, the strongest secure storage laws are a general requirement for anybody, regardless of whether a child is likely to gain access, regardless of whether a child is likely or you reasonably know they would be in the home, to securely store that gun in a locked, hard-sided container that is, makes it more difficult to access. And what we know is that, states that have this, we do see reductions in youth suicide where these are in place, where they're properly implemented. So not just about having the law, but also changing the culture around responsible gun ownership. Responsible gun owners do not leave their guns unsecured.
So you talk about the best type of safe storage laws? What are our laws surrounding safe storage in Minnesota?
That's a great question. So in Minnesota, you do impose liability for negligently storing or leaving firearms where you know or reasonably should know a child is likely to gain access. It would be ideal to have a stronger secure storage law in Minnesota.
Maggie, what initiatives do we have going on in Minnesota to improve the safe storage?
Yeah, so for the past several legislative sessions, we have been working on that stronger storage requirement that Kelly mentioned. So the law that has been proposed a couple of times would mandate that when in the home, your firearm is safely secured in a lockbox or a gun safe when not on your body at all times. We have had some progress on getting hearings for that and on making sure that legislators are starting to understand how important this legislation is, but we are still working on actually getting it over the finish line. So in the same way that it took us a really long time to educate legislators about ERPOs and how important they are in preventing gun deaths, we need to do that same type of education when it comes to safe storage, but hopefully it won't take as long to actually get it done and over the finish line so that we can get to the implementation stage so that it starts saving lives here in our state. And, we've seen the consequences of not having this law. Last year, there were several children who were shot, some of them killed in their home with an unsecured weapon owned by a parent or guardian. So it is vitally important that we get this law passed because it will save those lives.
Can I add one thing to
Yes,
that?
of course, go ahead.
I think that Maggie's point about, children are already being impacted by this. I think if I could urge lawmakers here, to the extent that they're listening, or folks working for lawmakers, to not wait for more tragedies to happen, really take that active measure now, because children are at risk every day. Minnesotans are at risk every day of firearms in the home. What we've seen with ERPOs is that the vast majority of the states and jurisdictions that have passed it have done so in response to a mass shooting, in response to a tragedy. And the whole point of public health, the whole point of these measures that we support is that they're proactive instead of reactive. And so just don't sit around and wait. Every 17 hours, someone in Minnesota is dying by gun violence. While we're sitting here today, someone might be dying by gun violence. So don't wait any longer.
Lisa, from a national perspective, what are some of the biggest barriers states face when trying to roll out ERPO laws effectively?
I think awareness is a huge issue, and part of my training and technical assistance, I focus on those that I believe and we believe need to have the highest levels of awareness at the onset. So law enforcement, prosecutors, and judges. And I think there's great variation in the state. I know there's folks even in this room that are highly experienced in ERPOs, use them in their work every day. I think that if law enforcement don't know how to use them, or that they are available tool, they're not going to use them. If judges have to refresh themselves every single time an ERPO comes across their desk because they handle them so infrequently, they're also going to second guess, oh, is the burden of proof met here? What factors do I have to consider when deciding if an ERPO is appropriate? So awareness, I think awareness for everyone is important, but especially those at the front lines of this work, law enforcement, judges, and prosecutors, social service providers as well, DV advocates, suicide prevention advocates, clinicians, all of those groups that are going to be interacting with those potentially at the highest risk. I also think for the rural communities here, just being realistic that a rural community may have one officer that's doing the job of 5 officers in Hennepin County or Ramsey County or some of the highly populated areas of the state, being aware that those resources are more finite in rural areas where they're also the highest suicide risk. So trying to meet those barriers and those needs. I will also say that Minnesota has access to federal funding to implement crisis intervention orders, including ERPOs. So thanks to a bipartisan bill passed in Congress several years ago, Minnesota can access $3.7 million every year to implement these orders. And we know that Hennepin County, Ramsey County have already put some of those resources to use in hiring ERPO attorneys to help with these cases. And so continue to advocate for the use of those funds and to then use those funds for ERPO, but also it can go beyond them in other crisis intervention orders.
Thank you. Tracie, what is your research? You talked about greater Minnesota, the rural Minnesota is a huge part of this conversation. What does your research tell us about the stigma and barriers that people in rural areas face when they are seeking help for a potential mental health crisis?
Yeah, so there are a few things I'd kind of like to address on this topic. So one of those is even the use of the word stigma. So when we talk about stigma, what we're looking at is negative stereotypes in general. The problem with using the word stigma around mental health and behavioral health topics with rural populations is it started to feel actually very othering for them. That is though the general population, when I go in and I introduce myself, I never introduce myself as Dr. Tracie Rutherford Self to anyone in a rural community because frankly, they don't care. They really don't. And on some level, I actually lack credibility the moment I do. I have to go in and be a part of the community and explain, hey, here's my background. So I grew up in rural West Virginia, and I have lived in the Midwest and worked in rural communities for the past 30 years. And that's really much more important for me starting to establish credibility than for me to go in and give any credential that I have. And so part of, I think, the work around rural Minnesota in particular is that I actually need to go back in and establish why I'm a trustworthy person from a mental health perspective, much more than I need to start talking about the stigma around mental health, because they've heard it so many times. And for mental health in rural communities, they're like, you don't get us. You don't understand. So I feel like that is one of the things that I get to go in and do. But in general, there are substantive barriers in rural communities that are really more of a systemic issue. So we look at available providers. We'll have areas where there isn't available providers for as often. It's a 2-hour drive that people may have to go in. We look at all kinds of other accessibility issues. So even if there is a provider in the community, they may be overwhelmed. There may not be enough hours in the day to see some of the people who are there. We also have to look at things like general, cost of mental health care from a state perspective. It can be financially devastating for many people to try to access that. And so how do we provide appropriate services for people who may not be able to otherwise access services? So we have to look at all the barriers and really, again, look at those systemic issues that we really need to find a way of kind of plugging that whole leak that continues to come in so that people are able, if we can get to the point of establishing increased credibility, we can actually then go on and say, hey, we also have the resources for you to actually access mental health. And we talk a lot about telehealth. And while telehealth certainly, I think, has had a much greater impact than I would have ever guessed in my almost 25 years of experience in this field, we still have to recognize that, first of all, many people in rural communities, they much prefer face-to-face. They will access telehealth. And again, some of that's generational, but for many of them, they want to see you. And what I told people when I first started practicing in a rural community, I used to think that I would go in and say, I'm Tracie, I'm a counselor. And instead, what I've just learned is I have to be just Tracie. And people will come see Tracie. They will also usually call when I'm in a small community and ask if they can come in the back door. There's a lot of different pieces about how do we kind of get through what it means to seek out services. So I think the other piece that we have to look at from a barrier perspective is starting to understand that behavioral health care is healthcare. In fact, the more we know about the brain and the way the brain functions in and of itself, getting away from this idea that if you just try harder, then you wouldn't need to access behavioral health care. And I think the other area that we have to look at is how we're actually training people. So we have clinicians who could potentially go out into the field today, but if I'm not the first call, by the way, we know from research, if there's a suicidal case, I'm like at call number 5 on a list of people, right? So unless I already have a relationship established with someone, they're going to call their cousin Bob. That's probably the first person they're going to call. They're going to call someone they know and trust. It's going to be clergy. It's going to be their banker. We talk about that a lot, particularly for farmers. Farmers, if they go in and they're having financial stress, the person they're going to see that first is going to be someone who's at that local level. And so a lot of it is then how do we get the community to understand what a warm handoff to a professional might look like? And the only way I'm going to get a warm handoff to someone from a professional in the community is if that professional already knows me in some capacity. And I'm much more likely to be successful in getting someone in for behavioral health care because I've gotten a referral because somebody else knew me, trusted me, and thought, she doesn't seem terrible. Maybe you could go talk to her.
For Maggie, Lisa, or Kelly, one of you said, you need to make sure it's used how people understand how it's supposed to be used. ERPOs are sometimes misunderstood. How do you respond to concerns about this fear of government overreach?
You want to take it from the legal perspective?
Yeah, I think that sounds great. I mean, having worked on advocating for and drafting many of the extreme risk protection orders, being involved in it, one of the major concerns that we hear is, somebody, usually a vindictive ex-spouse, will go before some kind of committee and they will make up a bunch of stuff, and suddenly you're having your guns taken away by law enforcement. And that's just simply not the way that these work. There are many due process protections built in to the extreme risk protection order process. You need to file a petition. That petition is under oath. It's being evaluated by a judicial officer who is making a determination about whether you meet or don't meet this burden of proof. They're required to consider many evidence-based risk factors for dangerousness. And then, if an emergency order is issued, you're served, you are able to then appear before a judicial officer to make your own case. So it's not the fact that there is some bureaucrat somewhere making a decision in a closed room where you never get to say anything about it, and your guns are being taken away. We do this in many different legal contexts, including domestic violence protection orders. We sometimes do it in custody cases. You can take property in some cases. So it's not as if this is the only circumstance in which this process has been built. It's also been evaluated by courts all over. So, for example, in the Second Amendment context, the Supreme Court a couple of years ago decided a case called United States versus Rahimi. This was a challenge to the federal law that prohibits people subject to certain domestic violence protection orders from possessing firearms. And what the court said there is that it is consistent with the historical tradition that where a judicial officer has found that an individual is a credible threat to the physical safety of others, that consistent with the Second Amendment, we can remove firearms from them. And that's exactly what extreme risk protection orders do. There have also been many courts that have evaluated this against constitutional claims under the Second Amendment, the Fifth Amendment, the Fourth Amendment, the First Amendment. So it's not as if there's no one weighing in on the appropriateness legally of these types of orders.
And in the states that have them, there are perjury charges if you falsely file. I've been doing this for over a decade. So going back to when California first passed their law in 2014, it was implemented in 2016. To date, there have been over 75,000 ERPOs filed across the country, including a lot in Florida, upwards of 20,000 in Florida alone. I can count on one hand the instances of misuse that I've heard of or read news articles about. And the vast majority of those have been simply someone not knowing how the law works. So filing it in the wrong county, in the county where they live, as opposed to where the respondent lives. Maybe they're filing it for something other than a temporary firearm removal, which is, again, not the purpose of the law. And so, as Kelly mentioned, there's due process protections built in. And what we see by and large is that these are working really well and they're not being used improperly.
Maggie, what is one thing you would like to see? I'm sure there are several priorities, but what are, the priorities right now, whether it's research, policy, education, to further reduce, firearm suicide, but just gun violence in general?
Yeah, I think there's a few things there. So we are a B state in terms of gun laws. So we're not amazing, but we're not at the bottom of the list either. But we still have some work to do in terms of policies. There are truly some bottom of the barrel basic life-saving measures that we still lack in Minnesota that we need our legislators to shore up, and we need there to be a political willingness to do that. Things like safe storage, things like lost and stolen firearm reporting, things like community violence prevention funding. There are a lot of basic policies we have yet to make sure exist in this state. So I do think there's a number of things that we can do in terms of policy that we're not yet addressing. And beyond that, we have a lot of great community resources for gun violence prevention that we're not taking advantage of, right? So I do want to make sure that I touch on Protect Minnesota's gun storage map. So this is, we've touched a lot on ERPOs and those as kind of your extreme option if someone is at risk to themselves or others. We want there to be options for you to get your guns off site and away from you that lethal means reduction before we get to a case where an ERPO is needed. So I do want to encourage folks to take advantage of those options in your own community. We do have our gun storage map in different locations all over the state of Minnesota, law enforcement agencies, gun shops, shooting ranges, private storage facilities that have agreed to store your firearm off site if that is a need for you. So if you or family member is in a crisis and needs to get those firearms away, that option is available for you. So it's not just policy, although it is policy. There are community strategies that we can implement at home in neighborhoods and communities to help prevent firearm deaths as well. And then beyond that, I would say we do need more research, right? There was a long time when we couldn't do any research at all around gun violence prevention. And it's newish here in Minnesota and around the country that we're able to really look at who is dying by gun violence, who is committing acts of gun violence. What are the root causes around that? How can we address specific prevention strategies to specific communities who are feeling the impact? So we do need to continue to lean in on that research, because without doing the research, we'll never understand why this epidemic looks the way that it does and how we can address it. So I'd say, those three platforms. Yes, we need to continue to shore up policy. There's a lot more that we can do here in Minnesota. We need to do the education so that people understand both what policies are available to them already and what other strategies are implementable at home in neighborhoods and communities to prevent gun violence. And we need to do the research to understand what this epidemic looks like. And so we can continue to build out strategies and policies that address it in the way that it presents.
You mentioned the gun storage map, which is an amazing initiative. That kind of leads into my question of, for the real, out in the real world, how can community members, whether friends, family, neighbors, how do they intervene when they believe someone is at risk? Someone watching this, what's the best way to handle that when it comes to if they think there's a firearm, or maybe Dr. Tracie, or
I can definitely get that. So
Dr.
there's
Rutherford Self.
certainly multiple opportunities. So one of those things simply is to start asking the questions. We have to get to the point where we start normalizing conversations around suicide, because for so long it's been taboo. And so people are afraid of offending someone. They're afraid of asking. With my adolescents, the phrase I hear most often is, well, they're just doing it for attention. And my response to that is, well, thank God, because what's the other alternative, right? We have no idea this is happening. So I think just on the boots on the ground level, the first thing we start doing is figuring out how to ask the questions. And there's a lot of different trainings that are available through multiple organizations and entities. So I've got an upcoming training where I'm doing a QPR training. So QPR stands for Question, Persuade, Refer, for custodial staff in the Mankato public school system. And one of the people had asked me when I told them I was doing this, well, why custodial staff? I'm like, well, who do you think finds your kid crying in the bathroom during play practice, right? So we have to start recognizing that suicide prevention is an everyday boots on the ground approach that we need to start taking to this. When we get to the point of an IRPA, we've already passed through several gates, right? So we're already very far down that plane, but what we have to do is start doing this when those first signs start to erupt and start to appear. So QPR is one method of training. There's safe talk trainings. There's assist. That's my absolute favorite. If you have an opportunity to do an assist training, and each of these happen within the state. But specifically, when we start looking at, access to lethal means, there is also the CALM training. So CALM is the counseling access to lethal means. And that is not designed for professionals. Certainly professionals can participate in that training. It's designed for a lawyer. It's designed for, again, bankers or for librarians or anyone who might be in a position to say, hey, there's something happening here. And those trainings, again, occur all throughout the state. I know NAMI does several of those. I also know that AgriSafe, if you would like to do one online, they have a really nice online option. I think the NAMI ones are also online. And there's a couple of those coming up in the next few months. So what we want is for everybody to play a role. And I think that's what's really imperative here is everybody has a role to play in preventing a suicide death. So whatever that looks like, whether it's how do I formulate questions, how do I ask someone about, are you thinking of harming yourself? Are you thinking of dying by suicide? We start to ask those questions by equipping the average person to be able to ask them.
I'm going to leave a little bit of time, or I can continue with questions, but if anyone has a question for any of our panelists, now is a good time. Yeah, right here.
I'm concerned about the lack of access to behavioral health counseling. I mean, who pays for that? And all of these things are getting cut. Counseling in schools is getting cut. So it just seems like that would be a great prevention measure that this would be addressed.
I'm also greatly concerned about that. I mean, part of it is my job is to prepare future counselors. That's a big part of what I do. And you all should know I have the best job on the planet. Like there's nothing that's more amazing than helping new professionals figure out how to go out and provide services. And we're really fortunate from a state perspective to have many opportunities to provide behavioral health services. And there are many organizations that provide that at low cost. The challenge becomes we don't currently have enough professionals to provide it. And part of the reason we don't have enough professionals, and there's many reasons to be entirely frank, is because we actually don't pay them very well. Have only about half of the people who are eligible to go on and become a licensed professional actually do so at both the state and the national level. And what many people don't realize is I have students who are graduating with a master's degree who would make more working at Target than they often make in their first few years outside of the profession. And so while we need more providers, we actually need to find a way to pay our providers better. And so one of the things that we're seeing is some of this can happen like through legislative action. That would be one of the ways. Medicare recently reduced the rate at which they are reimbursing mental health providers. I don't know if anybody's been grocery shopping lately, but it's really hard to then take Medicare when you're not getting compensated at a rate that feels fair or appropriate. We see the cuts to Medicaid potentially coming, and that's something else that's very concerning. And so what ultimately ends up happening is for the providers who are in the field, we see clients on our own time and backs, and that leads to incredible amounts of burnout. Because if I can't afford to pay my rent, or I can't afford to pay back, frankly, my student loan that I had to take to go through graduate school, it's really hard to remain in the field. This is also particularly pervasive in the rural communities. So one of the things that we know from previous studies we've looked at through the Center for Rural Behavioral Health is the most likely option to get someone to return to a community that's rural to provide practice is to have come from that community or that area already. So we have to do a better job of recruiting from rural communities, as well as then providing support to send people back into rural communities to provide that. So again, we're seeing great initiatives. The Center for Rural Behavioral Health is one of the ones that, yeah, I'm there and I'm a part of it, but I really believe in the mission. And the mission has been, we will provide services to anyone. You can get a full hardship waiver if you need to, because you don't have any other access. But at some point in time, we'll run out of providers in space. And when that happens, we're trying to find other people, because wait lists can be nominal in some cases. Like sometimes I'll see clients who get in another place in 2 weeks, but more often it's months. And when we're talking months, when someone is potentially suicidal and they aren't necessarily at a point that's severe enough to need to go into an inpatient unit, that's a very long amount of time. And again, the state of Minnesota actually does a really decent job compared to other locations I've lived in, but it still isn't sufficient.
Anyone else have any questions?
Yeah, again, that same vein, I don't know if will affect anything you do in your work, but there was a Minnesota Public Radio story just this morning about 60 rural health educators in Minnesota Extension being cut.
Mm-hmm. And again, we've got lots of positions that are being cut that we're incredibly concerned about, because the work really, it continues with the people. This isn't something that can continue without the people. And certainly it's great that in Minnesota we have like peer recovery specialists. We have other people we're training who are more mental health people that do a phenomenal job of getting out there. But how do we continue that training when there isn't funding at this point? And how do we continue to provide services? So like I said, I'm number 5 on the list to be contacted anyway. Who are the people we're passing through before we get to a mental health professional? And how can we kind of better equip them? It's a big part of the work I do with the center. So one of the things that we identified in the report that we did on suicide through the Center for Rural Policy Development and the Center for Rural Behavioral Health is establishing more anchor members in communities. That's why I work with first responders. We go in and we're working on training first responders, who are often the first person on the scene, on how to respond appropriately to a behavioral health crisis, and then how to make a referral. And we do that specifically with rural first responders, because rural communities are the ones who have the greatest lack of access to care. And they may be the person who gets called, right? So even if it's not for an emergency situation, Susie, who lives down the street, knows her neighbor is on the squad. So she calls, Tanya, and it's like, I'm having a really tough time. But what we have to do is make sure Tanya knows how to both be appropriate, ask the right questions, and then refer to appropriate services.
Mm-hmm. Yeah, go
My
ahead.
thing is this, again, I've told people about their fault, and their smart things that, again, just really the logistics. I mean, you say, okay, you gotta, I'm a judge, you have to do, long, but Do you call 911 and say, I'm concerned about this? And, you know, I mean, how do you really, the nuts and bolts of how you access this?
Yeah, I can chat about that a little bit if it's helpful. So an ERPO petition is extremely easy to access. You can Google it. If you Google ERPO petition Minnesota, you'll find it. It's on the Protect Minnesota website. It's only a couple of pages. It's very easy to fill out. What you want to do is bring that down to your local courthouse and drop it off there. And that's how you get it in front of a judge. So you can either fill it out online, print it out from the internet, fill it out at home, drop it off, or you can go in and ask for help filling out an ERPO petition, and that will be it will be supplied to you at your county courthouse as well. So there's a couple of ways to access it. It really is a simple process. And again, if you don't feel comfortable filing a petition, but you think that somebody needs help, that you know someone in your family, you can refer that to law enforcement as well and contact law enforcement and let them know you have this concern. Here are the threats that I've heard. I'm really not sure what to do, but I think an ERPO is appropriate here. And law enforcement are empowered to petition in the state of Minnesota, and hopefully they'll be able to help you with that as well. Did I leave anything out there?
Yeah, I mean, I think in terms of specifics, if you're like, if it is an immediate crisis,
Yeah, I mean,
like,
8 to
yes.
5 at this courthouse. You know, what is it, the, you know, Monday through Friday, we've got Saturday, Sunday, we've got evenings, and when a lot of people are having more trouble.
Yeah, well, I mean, maybe you can talk more about the 24
Yeah, so
seven
you,
access.
so you can certainly call 911. We obviously realize that going to a courthouse is not feasible for everyone, nor do they want to file. And so we think it's appropriate and important that there be other parties eligible. You can get these after hours in some circumstances. It is designed, the ex parte, the temporary order is really designed to be immediate, recognizing violence doesn't just happen Monday through Friday, 9 a.m. to 5 p.m. Threats don't happen. I would encourage, and I will plug this guide that I know you have a copy of. This is specifically for Minnesota, includes actually the petition and some of the forms on the back, and we've been happy to have great partners in the state that we're working with. Another model that I believe folks in Minnesota are adopting is an ERPO advocate, so someone who is designed to help the civilian petitioners navigate this process, because law enforcement is familiar with protection orders. They've done them for decades. But how do we help folks that are less familiar, even for someone like myself who deals with ERPOs every single day? If I needed to get one for a loved one, I think I would be flummoxed by the process as well. And so I agree with Maggie. If you just Google ERPO Minnesota, our website comes up, her website comes up, the court's website should come up, and we're all here as resources as well.
Lisa, if you could hold that up again to the report, in case you missed it when you're walking it, there are copies over there. If you didn't get it for members of the media as well, I believe there's also a condensed document
Yes.
right next to it too, if that's helpful too.
Yeah, and if I could just plug one more thing, you know,
Sure.
if you are in that immediate crisis, you can call 911 if there's immediate threats to self. The other thing I would say is, you know, call that 988 number. That's what it's for. It's a resource for people who are kind of actively on the edge of suicidality, to get them resources and get them help in that moment. So I would say take advantage of that resource as well.
I'm going to add to that just briefly, because while we've historically assumed 988 was specifically for suicide, and certainly that is a big aspect of it, they will handle any type of substance use or mental health concern. So you don't have to wait till someone is in suicidal crisis to call to get those resources. And I also think it's really important that people understand, when you are contacting 988 in the state of Minnesota, the vast majority of calls stay in Minnesota, and they are with people who are trained in Minnesota. Because sometimes people are reticent to call because it's associated with a government entity. And so I think it's really important that people are aware of what 988 really is and what it does. It's a phenomenal opportunity and resource. And there's also mobile crisis units that are available in each of our counties that will come out if there's a concern. So you have access to those from a local county perspective. If you also are like, hey, I'm concerned, I don't know what else to do, law enforcement can't get here for a little bit, there's some other options that you can pursue.
Any other questions?
I have one more. So the three of us and, you know, people in our Mom's Command chapter and our Be Smart chapter here do a lot of table work. And so Maggie, I have a question for you. What is the, we have been asked, so I don't really want to do an ERPO, but I want to get this gun somewhere safe. So where is the closest resource for those of us who talk to people in our area that they could take that gun?
Yeah, absolutely. So please access our storage map. It does, I don't know off the top of my head what the closest one is in Olmsted County. I'm sorry. We are looking at expansion into Olmsted County specifically. So hopefully within the next 12 months, we'll have a guide that is for this county specifically. But it's going to be, within a pretty reachable radius for someone to be able to take advantage of those resources. And offsite storage really is key. If you're not at a point of wanting to file an ERPL, but you just want those firearms out of the house, taking it somewhere that has agreed to safely store that for the period that it takes to address that crisis. As Dr. Tracie said so many times, the best thing that you can do is just reduce access to those lethal means for the time it takes to address that crisis. So please access that map. It is, again, on our website. You can also find it by Googling Minnesota gun storage map. And we are looking at a specific expansion into Olmsted County. So hopefully within the next 12 months, we'll have even more access within this area.
And with that, I want to be respectful of our time. I want to thank all of our panelists for coming here today. If you want to learn more about ERPOs in Minnesota, or how to get involved in gun violence prevention work, the safe storage map, things like that, please do check out the work of both Protect Minnesota, the Center for Gun Violence Solutions, and Dr. Rutherford Self as well, the research coming out of MSU Mankato. And thank you for taking time out of your day today. Thank you for coming. And members of the media, if you have any questions or anything like that, feel free to come find any of the panelists after. Thank you.
I know we're, that's what, and a lot of.
You want this copy?